training during pregnancy is the biggest myth in India, especially. Pregnancy by itself tends to completely survive on the fact that the women accumulate. I focus more on the mobility, I focus more on the flexibility training. I can say majority of the people I have trained have not put on more than 10 kilos. They've almost always had natural delivery. Whenever you decide to start, whenever you decide to focus on your health, is the best time.
Sports nutritionist, pre and postnatal fitness coach, and the founder of Vigor. Our guest today on the Settle or Be Better podcast is Dr. Sneha, who's going to be talking to us about all things pre and postnatal exercises. So, welcome, Dr. Sneha, and over to you. Why don't you begin by telling us a little bit about your personal health and fitness story?
Thank you so much, actually, for having me on board with this podcast. Also, this is my first ever podcast, by the way. So, super excited.
Lucky me.
I basically am a doctor turned fitness entrepreneur, is how you put it. I had a very normal childhood with an extremely educationally oriented family, which is why I was pushed into doing medicine. I was never fully interested in it, but I got a merit seat, and it was it was a decision I just had to make back then. But I think over the years, I've started to see that my passion was more into fitness, health, and mental wellness. And I guess I was in a way able to pave my own path into it. And that definitely began with my own personal journey with finding exercise and fitness so therapeutic, and being able to stick to a good nutrition plan was helping with so many of my health conditions. So I think it was only natural that I started to preach what actually worked for me, and that was how my journey began.
Lovely. That's a great story. Thank you so much for sharing that with us. So coming right to our topic today, that is pre and postnatal exercises. My first question is that, when it comes to planned pregnancies, when women, go for that and they have this plan in their mind that, this is the year that I would like to conceive. And so how does one approach this? Is there something that they should be doing before conceiving, some things that they should have in their mind?
So I think... coming from a clinical background, there are a lot of things that you need to be considering. Once you start your planning and then you visit a gynecologist, of course, they're going to put you on the bare minimum health supplements. But that's just one aspect to it. A lot of people, especially in India, tend to overlook what a huge role, fitness has with regards to you enduring the pregnancy, and then the outcome of that, and also the whole postnatal recovery that happens. So we tend to completely put aside your musculoskeletal health aside from everything else that the body goes through. So I think for me, when someone approaches me, at the time of the planning, I tend to look into all the health conditions they have, because a lot of people do already deal with, let's say, diabetes or hypothyroidism or other lifestyle conditions, right? And then with exercise, it's very much possible to control these lifestyle conditions, to control the symptoms purely from nutrition and fitness. And then your body is sort of prepping already to have a more healthy journey through those 9 months. So that is one aspect. And the other aspect is for those who are a tad bit overweight. You know that you're already going to put on quite a bit of fat percentage through the pregnancy, because pregnancy by itself tends to completely survive on the fact that the woman accumulates. So whatever you do consume, it is only physiologically normal that you're saving that as fat, because that's what the growing baby is in need of. So there's already going to be a lot more weight gain that will naturally happen. But is there a way we can do it in a controlled manner? Is there a way we can do it in a healthy manner? So if you're already overweight, then there's probably a little bit of prep that you can do, which is dropping down the fat percentage to some extent, getting a little bit stronger, and of course correcting any kind of postural abnormalities that you already have, right? Because your posture is only going to change over time in the course of those 3 trimesters. And if you're already, if you already have so many setbacks, it is possible to rectify them and be prepared enough, to get through the pregnancy. So there's definitely a lot, like the health aspect is one thing, your health conditions are one thing, but your postural abnormalities, your musculoskeletal strength, if you have any other health conditions accompanying all of this, we can basically, it is possible to rectify a lot of them, and so you're preparing better for the pregnancy.
Right. Understood. That was really well explained, because there's a lot of confusion and doubts going on, in a lot of women's mind, that when is it and how is it that I should approach this the right way. And obviously, pregnancy or no pregnancy, there's no doubt that we should definitely lead a healthy lifestyle and we should be working on our strength and our fitness. But just for an example, if there's someone who hasn't been that active in their lifestyle, over the years, but now that they want to, think about their pregnancy and plan it. So, like, since when should they start preparing their body for that?
So, see, I mean, there is no right answer to that question, because whenever you decide to start, whenever you decide to focus on your health, is the best time, right? It doesn't matter if you have 1 week at hand. It doesn't matter if, like, you start training and then within 2 weeks you get pregnant. It's always best to start wherever you are, because if you have a good coach, if you have a good professional looking after your health, there is a way you can progressively, increase gradually increase the weights you're picking or the kind of activities you're doing, right? So there's a way you can be taken through it. So I would say, ideally, everything we discussed in the start, the ideal situation would be you focusing on all of that first, being able to get to a point where you've probably rectified a lot of those health conditions, or at least control it, contain it, if not completely, solve it. And then maybe then your body is ready enough. So for some people that can be 1 week, for some people it can be months of work. For some people it can probably take years. So I do have people who come to me with zero experience of fitness, and all they want to do is at least be a better parent now, even before they get pregnant. So starting somewhere is better than not starting at all, is what I would say. But it really depends on the goals. It really depends on your background of health and fitness. That would be the right answer. But there is no general answer to that question.
Got it. And coming to posture correction, what role does it play, and how important is it to focus on that in terms of having a healthy and pain-free pregnancy?
Yeah. So this is, one of the most important goals of pregnancy and prenatal training. And a lot of people think, why should pregnant women work out? Maybe they should just be at home and rest it out, because it's a very big myth. Training during pregnancy is the biggest myth in India, especially. And I still did, even in this generation, face this with my clients' families, right? But a lot of people don't see that the goal of pregnancy and prenatal training is not to lose weight. Controlling the weight gain is one aspect, but I think for me, most important goal would be to correct the posture, because what happens through those 9 months is, because of the growing abdomen, because of the growing fetus and the size of your abdomen, a woman's body changes drastically. There's going to be a lot of arching of the upper back. That's called thoracic hypothesis, and then there's a lot of arching of the low back, which is your lordosis. There's a very, a big postural change that happens. And so the goal of the training is to, how do we rectify that rounding? Can we strengthen the upper back so you get back to the natural posture? And how do we strengthen the hips and the lower body so that extra arching in the low back doesn't happen? Because these are the conditions which lead to a lot of, low back issues. These are the conditions which lead to a lot of neck issues. And then over time, they're having knee issues because the posture is so off. So a lot of women think that resting is, enough and they'll be fine. But then there is a way you can strength train. There is a way you can train your flexibility and mobility so you do not land in these positions, right? So you can actually reverse what the body is naturally designed to go through. And I think it's also important to understand that there is a hormone relaxin which sort of shoots up during pregnancy, because it is trying to create a system where towards the end, the body finds it easy to, to go through the birthing itself. That's why it needs to have this hormone. It's very important. But what that hormone does in the process is that it can make your joints very lax, it can make your ligaments very lax. So if you do not strengthen the right joints and the muscles in the right way, I mean, if you strengthen the muscles, you're in turn strengthening the joints. If you don't rectify these, then you are more at risk of, falls or injuries or losing your balance and coordination. So all of this is it's just basically a part and parcel of that postural change that happens. So it is absolutely, the most important goal you need to have during prenatal training.
Got it. So, what are some exercises that are crucial when it comes to posture correction? I mean, obviously, women should definitely go and train with a proper trainer and a coach because that will give them better guidance. But if you could just name some and some basic exercises that could help them to correct their posture.
Yes. So, exercises have so many names now thanks to functional training that what I would like to focus more on is what muscles do you actually strengthen, right? And what muscles do you also have to loosen or stretch? Because what the posture does is, if I take the example of what I just mentioned, the thoracic kyphosis is just rounding forward. So that leads to a lot of stiffness of your shoulders and your chest. So you need to do a lot more chest openers, a lot more shoulder openers and stretches. But that way you're opening up the front, but you're also simultaneously having to strengthen the upper back muscles. So your rhomboids and your external rotators and the back of your shoulders, all these muscles need to be strong enough for you to hold that position. And I think this is one of the biggest things which happens because one of the biggest things you have to look into, because once you deliver, that stiffness is only going to get worse when you hold the baby, when you feed the baby. So you're only going to make an already stiff muscle even more stiffer because you've not done anything to rectify it. But if you'd actually focused on, rectifying your posture, strengthening the weak muscles, then you're also putting yourself in a better position during the phase of lactation while, carrying your child and all of that. With regards to the lower body, your hips take the biggest beating, your pelvic floor and the core takes the biggest beating because it's completely expanding. And then there is, the muscles are basically completely outstretched, and you need to focus a lot on strengthening the pelvic floor muscles, not just to go through the birthing phase, but also to support your hip in general, support the spine and the hip in general. It's a lot of training of your glutes, which are your, hip muscles, and then your inner core, because a lot of people think that your core is just your six-pack muscle. But that is just the outer core, right? Your outer core is completely your midsection. But people don't realize that the core is the midsection, is the literally the center of the body which holds all the joints together. So a lot of people fail to understand that the inner core, which is the inner layer which you can't even see with your naked eye, that needs a lot of training as well, and that almost always works along with the pelvic floor. So all of these take a lot of stress during pregnancy, and these are all the muscles that you need to really focus on. And that's one strength aspect of it. But like I said, you need to focus on flexibility and mobility training as well. And definitely your cardiovascular training, because a lot of people, again, think that it's a myth. Cardio during pregnancy, it's not heard of. But I make my pregnant clients do just the same things as I would make my non-pregnant clients do. They are hopping around, they're jumping around, because if you understand how to engage your core, you really have no restriction from doing any movement. You have no limitation. So the problem with some coaches saying don't do high intense work is, of course, if they don't have any background of training, you can't put them through something that intense. But the other thing is they do not really understand the engagement of core. So if you do understand that, there's a lot more movements you can do, because the core holds you like a little corset. So it holds everything together, including your baby. And so you're in a much stronger position to do, so many other activities. So I think these are the points of focus when it comes to, fitness during your pregnancy.
was really insightful, because this gives a sense of direction to a lot of women, in terms of how they should approach their training, and really what is it that they should, focus on. Because of course, this might be there that, okay, I need to work out, I need to move my body, but what sort of a movement and what to focus on each day. So that's something really important. And in terms of movement, is there anything that women should avoid during pregnancy? I mean, of course, keeping aside the complications, there can be a lot of things, but say that there are not many complications, and are there any movements that they should particularly avoid doing?
Yeah, and that's a very valid question, because and as you rightly said, there are indications of prenatal training. There are indications, contraindications for prenatal training. So there are some conditions where you're absolutely not supposed to move, and you need to completely take rest. But once, like you said, they're cleared of all those complications and they're good to train, I would say some real big no-nos for training is, extremely high-intense activities, especially if they don't come from a background of fitness, right? If you're an athlete and then you get pregnant, you're at a different level already. But for an average individual, I wouldn't recommend anything beyond, moderate to intense level of, activities. And also a lot of sudden change in rotation or sudden change in movements, something that's too explosive. These kind of things, again, it goes back to what I mentioned about relaxin and how lax your joints are. So you're not necessarily in control of, how flexible or not you are. And that's something that a woman probably understands through the phase of the pregnancy, because a lot of them end up with falls, or a lot of them end up with subluxation of joints, because they don't realize how flexible they get. So you need to really focus on the right strengthening to be able to do these jumpy, jerky kind of movements. So I would say a big no would be these kind of sudden, explosive, twisted, jumpy movements. But also another big no would be not combining the right kind of training and only focusing on cardio, or only focusing. You need to really combine the right kind of activities and understand that you're basically, technically you're pumping blood for two. So where is the conditioning for the heart? You need to condition your heart as well, which is why cardio is quite important. And I would say the third thing would be no lying down exercises past 20, 21 weeks of your pregnancy, because in this phase, your abdomen, your uterus basically is quite big already as the fetus is growing, and it tends to push against your really big blood vessels at the back of your body on the posterior side. And this tends to cause a bit of compression, and then that limits the blood flow, back to your heart and your lungs. So this can be quite, in clinical terms, it's called supine hypertension. So if you suddenly lie down and there's that compression, and then you get up, you feel a bit like blood is just rushed down, and you feel a bit lightheaded. Of course, that's very risky for a pregnant woman, because, what if they end up with a fall? And also, what if they restrict the blood flow to the growing baby, which is obviously so crucial. So lying down movements are a complete no. So past 21 weeks of pregnancy, I don't make my clients do any exercises where they're lying down, like lying glute bridges or any kind of core activity. Everything's usually like seated or inclined or, propped up position. So these I would say are your definite, probably what you shouldn't be doing during prenatal pregnancy.
Lovely. Understood. And some of it you already answered, but how does approaching movement change between each trimester? In terms of duration, in terms of repetitions, and how much time in a week should they spend on it?
Like I mentioned in the beginnings, actually, there is actually no real limitation in a pregnant woman. They should be able to do, ideally, they should be able to do everything like any other individual. So if they want to work out 5 days, 6 days a week, then that's great. But there's a minimum amount to reach all the goals that we've discussed. At least, 3 to 4 days of a week of training, at least 45 minutes of a workout, right? So that's your good enough range. But the reps and sets and all of that depends completely on, what kind of strength movements you're doing, what kind of cardio movements you're doing. So all of these are quite important. But with every trimester of pregnancy, I would say the real limitations are the physiological limitations, because in the first trimester, a lot of times gynecologists or obstetricians do not give the woman permission to begin, training, because they like to keep that as a safe period to make sure everything's okay. It's a very crucial phase of any woman's, pregnancy, obviously. So they like to be careful. So the first trimester is usually, making sure they get the form right, they get the technique right, they get, the the foundational movements of exercise right. Because if that is good, then we can work on, more through the next few weeks. And then the second trimester is like the honeymoon, phase of pregnancy, because they have so much more energy. They do not have the morning sickness, which they usually do during the first and the last trimesters. So they're a lot more active. I feel like some of my clients have been literally as fit or fitter than my non-pregnant clients during the second trimester. So you're allowed to do so many things. Your body allows you to do so many things during your second trimester. Other than the lying down exercises, I wouldn't restrict them with anything during that time. And then the third trimester, in my opinion, is mostly about really understanding the pelvic floor and getting them to do a lot of hip openers. Aside from everything we're doing, their energy levels in general tend to get a little bit low. Obviously, the baby is a lot, the uterus and the baby are a lot bigger, so they're carrying a lot more weight. So they tend to get tired a lot easier as well. So you can't really, challenge them the way you can during second trimester. So I normally reduce the intensity of the workouts. I focus more on the mobility. I focus more on the flexibility training. I make sure really the pelvic floor is, prepped enough to allow the kind of expansion and all the work it has to go through during the birthing itself. So that would be my focus towards the last trimester. But the overall goals of the training, are still the same. It's the way you play around with it.
Got it. Understood. And what are the goals of pregnancy that you usually like to work with? What is it that you want your clients to understand in terms of what their goals should look like, and what would be a healthy way to look at
I
their
think the
goals
most important is, because I know the number of people who want this, the most important thing is to understand that weight gain is normal, is required, is healthy. So it's more about how to maintain that weight gain in the healthy range. Okay, so ideally, if you are training the right way, if you're eating the right kind of food, you shouldn't have to put on more than 8 to 10 kilos, maybe 12 at the most. But nowadays we have people putting on like 18 kilos, 20 kilos, 22 kilos, and it's almost normalized in a way. But it's genuinely not required. I can say majority of the people I have trained have not put on more than 10 kilos. They've almost always had, natural deliveries, and they've almost always bounced back to fitness right after the delivery. So I think that shows, what a huge impact prenatal fitness has, through not just the amount of weight gain, but also how soon you recover right after the delivery. So I think the main goal for an individual, for a new mom, should be looking into their psychological well-being and the psychological benefits of fitness as well, because your body goes through a lot, but that takes a lot of mental toll as well on you. And I think a lot of women face anxiety, they face symptoms of depression during and even after. I think understanding how great just movement makes you feel during, and in return, how calm you can be about everything that's happening, and how accepting you can be, and what a wonderful mother you can be right after. All these are important goals to have as well, and a lot of people tend to overlook them, right? And then also keeping in mind that your goals should ideally revolve around any kind of health issues you have. So I've had situations where new moms have come to me with family history of diabetes or gestational diabetes, especially, which means you end up with symptoms of diabetes during the pregnancy, or gestational hypothyroidism. So these conditions are actually completely contained with fitness during your pregnancy. So, and I've been able to keep their, hormone levels at check just because we were training regularly and keeping consistent with it and eating clean food. So these are the right kind of goals to have, right? I think that is definitely changing. I'm seeing that a lot as well in women. They're looking at, fitness from a very holistic point of view, and that's beautiful to watch. But I definitely would want to stress on these because sometimes it tends to get lost in the current obsession with social media and how you should look and things like that. I think the physical benefits of training will happen, will come. It goes without saying. But there needs to be a lot more stress on all the other benefits of fitness.
Absolutely. Understood. I mean, definitely, like how they say, change your physiology, change your state. Even a 2 shift in your physiology can, have a major impact on how your mood is currently or how you're dealing with the whole situation. So that would, I feel like, definitely make a lot of women feel less caged or stuck, because of being pregnant and, having that restricted kind of mindset. So that really helps a lot. Coming to diastasis recti, if I'm pronouncing it right. Can you shed some light on what that is and
Yeah,
how should
you
one deal
pronounced
with
it
that?
absolutely correct. So it's diastasis recti is basically a very normal phenomenon that happens in almost, I think, 70 to 80% of women, towards the end of their trimester, and it also tends to stay after as well. So if you imagine the six-pack muscle, there's always this thin line in the center. So that's a very thin connective tissue that holds these muscles together. It's called the linea alba. And what happens during pregnancy is because of the expansion, your muscles can only stretch so much. But because of that massive expansion, that connective tissue tends to tear, and there leads to a little separation between your abdominal muscles. Now, like I said, it is a normal phenomenon because every woman's abdomen will stretch, will expand over the course of the 9 months. But in most of the cases, it tends to, or it's supposed to come back to normal within a month and a half or so. But when women do not take care of their, take care of strengthening their muscles appropriately during pregnancy, that's when they tend to see the most damage, and that's when it's the hardest to, completely recover from it. So a lot of times post-delivery, sometimes it does come close, and then sometimes there is still a gap, and that becomes the new normal for the woman. That becomes the new functional abdomen for the woman. The reason I say functional is what we try to rectify with, you can't reverse, you can't stop diastasis from happening, but what you can do is you can definitely stop it from becoming dysfunctional. So when it is not coming close together the right way, when you've not strengthened your muscles the right way, then it can lead to back pain or pelvic pain, or eventually, basically it's a sign that your core is still weak, and that can lead to other, dysfunctions. So that's what we can try and rectify. So a lot of women will see this, but it's about how do we control it with the right kind of training. So how do we avoid it, and how do we sort of reverse it to some extent? One way to understand it during pregnancy is because during pregnancy the abdomen is already big, so it's hard to understand this phenomenon. But one way to know is called coning. Whenever a woman doesn't, whether they're pregnant or postnatal, when they're not engaging their core correctly, and what I stressed on is activating the inner core, the innermost layer of your abdomen correctly, there will be a little bulge that happens. It's like a little oval bulge that happens, and that's called coning. So you can see that if you really observe a pregnant woman lifting something heavy without engaging the core, you tend to see that. Or even postnatally, if they're trying to do your conventional lab exercises like crunches and things like that, that's something you can immediately see the coning. So you need to. It takes a lot of mind muscle connection. In fact, majority of the time I spend with a pregnant client is making them understand the core, because if that foundation is right, they can lift however heavy the weights are. They can do whatever kind of cardio. So that's very, very important. And I think, since I just said conventional core training, one thing you probably should avoid in prenatal fitness, going back to the previous question, is you shouldn't be holding your breath or doing your conventional lab exercises like crunches or sit-ups and things like that. So those are a big no-no as well. Yeah.
Got it. And I also missed out on asking something earlier about engaging the inner core. So, can you give a few examples on how
Yeah, so
exactly can we do that?
I follow something with my own clients, and this I guess is not there anyway, but I've come up with it where when I teach them how to engage the core, the easiest way to understand if you're doing it right is if you can take two fingers and sort of push, right below your pelvic bone, if you push your two fingers deep and then cough. When you cough or sneeze or laugh, your inner core automatically gets activated. So it's actually subconscious protective mechanism that the body is already doing for you, right? Now, what we are trying to train is how do we consciously do it? How do I do it when I'm squatting? How do I do it when I'm, holding a plank? Or how do I do it when I'm carrying my baby? So when you cough and you feel that, that's where you know you've really engaged the lowermost part of your abdomen. But how you consciously do that is the ideal way is to really bring the chest down to the lower abdomen. And I follow this method called EEE, which is try and always engage the core when as you're exhaling at the point of exertion. So when I'm going down in a squat, to give a simple example, it's going down is always easy. You're dropping to gravity. Coming up is the point of exertion. So as I'm coming up, I'm going to exhale. And so this way, people don't need to memorize when to exhale, when to exhale. The ideal way is to always, right now as I'm talking to you, I have my core tucked in because that's something I practice. But to start with, you can always practice by engaging as you exhale at the point of exhalation. And then eventually it become a habit to keep it tight. There should always be a subtle contraction of the lower abdomen. It's not as prominent as you doing your crunch because that works the upper arm, which is a lot easier to we're always using the outer core. That's the biggest muscle. But smaller supporting muscles that we that's why when you cough, laugh, or sneeze, the body automatically
Right. Understood. That was really well explained, and it definitely solves a lot of questions. We are just concluding our episode today. That was really insightful, and this answered a lot of doubts and questions that I'm sure that a lot of women might be having when they're approaching this phase of their life. And concluding, I usually ask guests if there's some message or a suggestion that they have for our audience in general. But after having this complete detailed conversation, I feel like I wanted to ask you, what message would you like to give the coaches out there, who might or might not be trained in pre and postnatal fitness, but just considering postnatal fitness, because a lot of coaches get clients, female clients, who want to lose their weight, after delivering. But how should we, what are some things that they should keep in their mind that they might not be keeping in mind?
Yeah. So I'll be very honest, because of my medical background, my clinical background, it's been a lot easier for me to understand what a woman goes through. I already understand the anatomical side of things, right? What's happening physiologically. What's extremely important for coaches, and I've seen this in my own experience, like a lot of people that I have worked with, is that education is key. And just because they are training one set of people or one set of clients, it doesn't mean that it's a one size fits all approach. You need to educate yourself. So I, in fact, am double certified in pre-postnatal exercise, despite being a doctor, because I I realize I'll be dealing with two lives at a time, and that's a huge risk, right? And then even post-delivery, I am dealing with so much more than just a woman coming, to lose weight after. She's dealing with a lot of emotional, baggage. She's dealing with a lot of overwhelming feelings of dealing with a newborn. So there's also that psychological aspect. I think a lot of coaches should understand mental health as much as they should understand physical health, because that's a huge, I think, gap in the current fitness coach scene. So educating themselves constantly, upgrading their skill by doing different courses. Um, and I think obviously understanding that the core is the core of everything. Everything. Whether you're an athlete, whether you're an elderly individual, whether you have injuries, pregnant, not pregnant, anything. Your core is the heart of the training. That's quite important as well. In fact, I do have a guide on my website. I have a guide that people can follow along and do workouts at home for both prenatal and I do have a guide for core training as well to understand exactly how. So it took so much of like studying experience and attending these courses to create these guides that that's when I realized how valuable education is. Even for a coach, you constantly learning and you constantly have to keep up with the new trends of fitness, all the new conditions that lifestyle conditions that people
Lovely. That was a lovely message, and it's a really important one right now because many trainers don't know some particular things that they should, consider when it comes to coaching a woman who's just given birth, say 3 months back or 6 months back. Even if the doctor has given a go that you can go and train, but I think even that's where women should also consider, coaching with a proper postnatal fitness coach, and that would really help ease around the process for them. So thank you so much for that. It was a really insightful episode, and thank you for gracing our podcast today. For the ones who'd like to reach out to Dr. Sneha, you can find the details in the description below, a link to her website and her Instagram, and also you can learn more about Vigor, that is her own fitness and wellness brand under which she takes her trainings, right? So definitely reach out to her, and there's just so much more to learn just from her Instagram page as well. So you can find the details in the description below. Thank you once again, Dr. Sneha, for being here. That's it for today's episode. I am Sakshi Pawar. I'll be your host for the Settle or Be Better podcast. So stay tuned while we bring more inspiring stories your way. You know the drill. Subscribe to the Settle or Be Better podcast. Like, share, and comment on our videos. And hit the bell icon because you don't want to miss the mind-boggling health discussions we're about to bring for you. Why settle when you can be better?